Welcome to American Medicine Today. I'm Kimberly Bonatti alongside Ethan Euchre. So an experimental vaccine has been shown to safely generate a strong immune response in treating particularly aggressive forms of breast cancer. Joining us to discuss is Dr. Nora Disis, Director of the Cancer Vaccine Institute and lead author of the vaccine study. Thank you for being with us, Dr. Disis.
You're welcome.
So why don't you first tell us about this development of the experimental vaccine and how did it come about and really how does it work?
The vaccine is targeting immunity to a protein called HER2/neu. This protein is extremely important in about 30% of breast cancers where it becomes highly overexpressed, and it's really part of the driving force of the disease. We've been studying how to immunize against HER2/neu for many, many years. But recently, new vaccine technologies such as mRNA and DNA really have made immunization much more effective in patients. So we encoded the intracellular domain of HER2/neu, which is much more immunogenic than the extracellular domain of HER2/neu, into a plasmid DNA. And we immunized patients with that DNA vaccine. And literally, it works like a regular vaccine. You immunize patients in the arm, the DNA gets into the skin cells in the arm, makes the protein in a very immunogenic way that stimulates the immune system, and patients make immunity to HER2/neu.
Do you think people are going to be hesitant to take a vaccine because of all the stuff that was going on? Even just the word vaccine, does it act like a true vaccine?
That's a good question, but I think you have to understand that not only do I have the word vaccine, but I have the word cancer.
Right.
And telling people that this vaccine may prevent their cancer from coming back, or we're working on vaccines to even prevent cancer, that is a whole new ballgame because most people see cancer as a death sentence. So we have not had anyone have any hesitation whatsoever. Of course, most of our early phase trials are in patients with very advanced disease, and they're just doing everything they can to live. But I've talked to my colleagues in the area too, and none of us have seen any vaccine hesitation for cancer vaccines.
And have there been any negative side effects? Because we know even with chemo, it's supposed to be killing off the bad cells, but it does take some of the good, and there's hair loss, different things like that. Any potential side effects with this vaccine?
That's what the beauty of the immune system is. The immune system is very specific. So immune responses are targeted directly to these abnormal proteins that are expressed in cancer. There have been many studies, cancer vaccines have been around for quite some time, looking at all the potential side effects. And the side effects are really very similar to what you see with the COVID vaccine: redness and swelling in the arm, flu-like syndrome for 2 days or 3 days, which is an indication that your immune response is revving up. Some fevers and chills, maybe a little nausea. So again, when you compare these side effects, which are generally very mild, with what patients have undergone with chemotherapy, people rather enjoy the break from chemotherapy that they're getting with vaccine treatment.
And is this to work in conjunction with either immunotherapy or chemotherapy?
Yes, in fact, now that we have vaccines that reproducibly generate high levels of immunity in most patients, we're beginning to use them in combination with immune therapy and with chemotherapy. And in fact, studies in different animal models have shown that giving a vaccine that generates high levels of inflammatory T cells that are capable of killing the tumor actually can help chemotherapy work better.
Really?
Would this only work with aggressive breast cancer, or do you think it would have any effect on other aggressive cancers?
Well, I think vaccines in general have three major uses. The use that they'll be approved for soon will be prevention of disease recurrence. And in many common solid tumors, breast cancer, colon cancer, ovarian cancer, we can treat your tumor and make it go away with surgery, chemotherapy, radiation, but the risk of relapse can be very high. And that's where the immune system works better, when the disease burden is low. The second place you're going to see vaccines approved are in actual treatment of established disease. You probably have heard about some of the vaccines that are targeting mutations that are showing some promise. And many of those are being teamed up with immune checkpoint inhibitors. So people are coming up with combination therapies focused on really giving the immune system a big boost to treat established cancers and make them shrink. The place where we're putting a lot of effort is in developing vaccines to prevent cancer. So these would be given to people with, gene mutation syndromes or different lesions that are not cancer, but really predispose them to develop cancer to prevent them from developing cancer. And this is a new area with a lot of interest where there are already clinical trials.
How many vaccines does one have to take to start and get a response? Is it one? Are you saying it's a series?
It's a series. So you're immunizing against really yourself, because cancer is ourself. So many of the immunogenic proteins are not foreign. So the immune system isn't launching a major attack. So it might take 1, 2, or 3 immunizations to do what's called prime the immune system. So get the immune response up to a certain level. And then after that, you will definitely need periodic boosters. Booster makes a difference. It makes the immune system, the immune response go higher. And in many people, if they haven't gotten an immune response yet, they'll be put over the edge with the booster.
Now, Dr. Disis, is the idea looking ahead that maybe it'll be like a regular, how we normally think of vaccines, where everyone will get a shot 10, 20, 30, 50 years in the future, where people won't have to worry about getting cancer at all? Is that the idea?
That's the idea. And I think that the therapeutic vaccines, the ones that prevent disease, relapse, or treat disease, I think we'll see several of them approved in the next 5 to 8 years. For the prevention vaccines, I think initially we're really focusing on people where we know they have a high risk, because we'll have to do trials to prove that the vaccines that are being developed lower their risk and prevent them from getting cancer. If we have a few wins there over the next decade, then we can start thinking about vaccines for everyone.
Well, this can certainly be a game changer in treating aggressive forms of breast cancer. Thank you so much for being on the program, Dr. Nora Disis.
Thanks, Doctor.
Thank you.
Take great care. Make sure you stay tuned. Coming up after the break, a story of recovery.